Presiding Officer, child and adolescent mental health services are in crisis, and they have been since long before the pandemic. Too many children and young people are having referrals rejected, and too many are waiting too long for treatment. Does the First Minister know how many referrals to CAMHS have been rejected in the past year, and how many children have waited more than a year for their first appointment?
First Minister.
I'm certainly very happy to give the precise figures to Anas Sarwar later on rejected referrals. However, while there are challenges in child and adolescent mental health services, as there are, and I've just been reflecting across the National Health Service, we have in recent months been seeing some very positive changes in waiting lists, actually the most positive changes for over half a decade. So the overall CAMHS waiting list has decreased in the latest quarter by 1,398 children since the previous quarter. Children waiting over 18 weeks have decreased by 658 since the previous quarter, and children waiting over 52 weeks have decreased by 281. And actually, that marks the first time that there has been a decrease in all three waiting lists since September 2016. So there's significant work still to do, not least to continue our progress in community mental health services for children and young people, but there is progress being made, particularly to tackle the longest waits, and I think that is something that should be welcomed.
Anas Sarwar.
8,873 children and young people have had their referrals to CAMHS rejected in the past year. 8,873. 1,248 had now been waiting more than a year for their first appointment. And the First Minister quotes statistics on those who have had their first appointment, but even those who have had a first appointment are still not getting the treatment they need. And here is just one example. Charlie is a Primary 7 pupil. He was referred to CAMHS in January 2020. In April 2020, he had a video consultation with a doctor from CAMHS, so would have dropped off the list referred to by the First Minister. But this is the last time he heard from CAMHS. He's had no diagnosis, and without treatment, Charlie has become withdrawn and doesn't like to spend time with other children. His mother found a video he had posted to TikTok where he asked if anyone felt like they wanted to die because they were so different. Charlie's mum told the CAMHS service, but they said it would make no difference to his waiting time. They told her that it could be another 2 years before Charlie receives the support he needs. This is not good enough. Charlie is not alone. There are thousands of children like him. First Minister, how have you let it get so bad?
First Minister.
Well, before I come on to the general issue again, let me say, obviously Charlie's experience is not acceptable. I don't know all of the particular circumstances of Charlie's case. As always, when individual cases are raised, I am willing to look into those. It is the case that there are waits for child and adolescent mental health services that are too long, but it is also the case that there is significant action being taken that is reducing already these long waits. And Anas Sarwar didn't respond to the information I gave him in my previous answer, but it is really important. Nobody is denying there is a significant issue here, but we are now seeing decreases in the numbers of children waiting over 18 weeks, the numbers waiting over 52 weeks as well, and the overall waiting list is also decreasing. So does that say there is not still a challenge? No, it doesn't, but it does say that the significant investment, the increase in the workforce, is now having an impact where we need to see it, and we need to continue that. In terms of rejected referrals, we have already accepted all of the recommendations in the audit of rejected referrals that was published in 2018, and we continue to act on them. 1 in every 2 referrals to CAMHS is actually seen within 10 weeks, and of course health boards have a duty to prioritise those that need to be seen most quickly. And obviously, where any experience doesn't match that, we of course have a duty to look into that and learn from it. Finally, Presiding Officer, we are also seeing a significant increase in those who are accessing community support for mental health services, which is an important part of that. Local authorities report that in the first 6 months of this year, more than 38,000 children accessed enhanced community-based mental health support services. And that is important so that we can ensure that those who need specialist services get it more quickly.
Anas Sarwar.
The First Minister is just not listening. If you get a first appointment that is a telephone call, but your diagnosis doesn't happen and your treatment doesn't start, but you fall off a list, that's not a measure of success. That's a measure of failure and demonstrates you're gaming the system. This was a problem that is long before COVID. When Charlie's mother phoned CAMHS, they said they were still waiting and working through cases from 2018. So that will be cases where they had the first appointment, but there will also be cases where treatment hasn't started and a diagnosis hasn't happened. And this government has never met its CAMHS waiting time. And according to Public Health Scotland, a quarter of all deaths of 5 to 24-year-olds in our country are from suicide. A quarter. In the words of Charlie's mum, our children are being failed and no one is doing anything about it. But we can fix this. So will the First Minister first reverse the cuts to mental health in primary care? Second, guarantee funding for schools-based counselling? Third, commit to increasing the proportion of the NHS budget being spent on mental health so it reaches 11%, the same level as England and Wales? Fourth, create a new referral and triage system for mental health so that no one is rejected. And finally, record and publish the true waiting time from referral to diagnosis and the start of treatment so that no child like Charlie is left abandoned.
First Minister.
Presiding Officer, I'll say again, because it is important, that experiences like Charlie's are not acceptable, and I don't know all of the circumstances, so I'm willing to look into that. And I'm not standing here and saying Charlie will be the only young person, far from it, in the country that has that kind of experience. But nor is it right to say that the progress I have narrated today is somehow unimportant, because that is the progress that requires to be made to ensure that there are far fewer experiences like Charlie's. In terms of funding, under this government, mental health spending has almost doubled in cash terms since we took office, and we will continue to support record expenditure across our National Health Service and ensure appropriate expenditure for mental health services. Of course, as I said earlier on, we are also shifting more treatment into the community. So one of the most important things that has been done, backed by investment, is the recruitment of counsellors across our secondary schools. These are really important issues, but issues again that, while it is right and proper to come to this chamber and state the challenge, our job, as I have demonstrated today, is to get on with the work of addressing these challenges. And as I have set out, we've seen a fall in the waiting list for access to CAMHS, and that's down to the investment and the actions that are being taken, and that's why it's so important that we continue with it.